York, the shining symbol of resilience and ambition, pulses with dreams that inspire the world.
I've seen tents being burned, I've seen people being run out, people being kicked in the face at night when they're sleeping. The hatred, it's prejudiceness. If we get rid of prejudiceness and understand that everybody bleeds red. You've got functional alcoholics. My dad was a functional alcoholic. Worked every day of the week, and he drank 2 cases of beer a day.
Yet behind its glittering skyline lies a harsh reality: homelessness. By January 2025, more than 158,000 New Yorkers, from seniors to young people with backpacks, were left without a place to call home. Shockingly, New York City alone accounted for 93% of the surge since 2022. These aren't just statistics. They are lives unraveling, proof that the American dream is slipping away for too many. Nowhere is homelessness in America more severe than here, driven by sky-high rents, failing safety nets, and global economic shocks. In this video, we'll uncover why this crisis has deepened, how it impacts every one of us, and what can be done to turn the tide. With the latest data and a spirit of determination, we'll ask, what forces are fueling this suffering, and can we reignite the promise of a home for all? New York, long seen as a beacon of ambition and grit, now faces one of its darkest challenges: homelessness. The U.S. Department of Housing and Urban Development's 2024 Annual Homelessness Assessment, released in December 2024, placed New York among the hardest hit states, with thousands struggling each day to secure stable shelter. At the heart of the crisis is New York City, where more people are sleeping in shelters each night than at any point since the Great Depression. The Coalition for the Homeless's 2025 State of Homelessness Report warns that by the end of 2024, the city's shelter population will have surged nearly 12%, leaving countless families and individuals without options. And it's not just the city. Communities across the state, Buffalo, Rochester, Syracuse, are seeing rising numbers that paint a troubling picture. Homelessness in New York is not just an urban crisis, but a statewide epidemic threatening the stability of millions. The rising death toll lays bare painful inequities. Families with young children crowd into shelters, while 1 in 8 New York City public school students heads to class without a stable home. Older adults, many battling mental health struggles or addiction, make up a large share of those unhoused. In 2024, thousands of new arrivals seeking asylum pushed an already strained system past its limits. Racial disparities are stark. Most shelter residents are Black or Hispanic Latino, with far fewer white. On the streets, thousands more remain unsheltered, and nearly 3/4 avoid shelters altogether, citing unsafe conditions, rigid rules, and lack of real support. The numbers are climbing fast. New York's homeless population surged 18% from 2023 to 2024, far outpacing national growth, according to HUD data. Chronic homelessness, especially among people with disabilities, reached record highs, compounding the state's crisis. Behind the statistics are faces that reveal a broken system. Children carrying backpacks, but with no beds to return to. Adults haunted by invisible battles. Newcomers fleeing danger only to find hardship. From overflowing shelters to hidden street corners, New York stands at a breaking point. The 2025 report warns that without bold intervention, the crisis will deepen as federal funding cuts loom. What is fueling this relentless rise? And how is a state with so much promise left so many behind?
So I was so hurt and upset, and just like I wanted to die. And I snorted the whole bag of fentanyl. I overdosed. They had to give me 2 things of Narcan, and eventually I woke up sick as a dog.
New York's homelessness crisis is rooted in one glaring reality: the lack of affordable housing. What began as a shortage has spiraled into a full-scale disaster. In New York City, the price of a modest 1-bedroom apartment now runs into the thousands each month, with Manhattan rents soaring to record highs. For families already stretched thin, these costs create an impossible barrier to stability. Affordable housing stock has been drying up for years. Only a fraction of households ever qualify for public housing or rental assistance, and those who do face long waits and limited options. In 2025, Governor Kathy Hochul rolled out a $25 billion plan to add tens of thousands of affordable homes, including units designed for the most vulnerable. Yet progress has been slow, leaving far too many New Yorkers feeling stuck in a system where the deck is stacked against them. The lifting of eviction protections in 2022, measures first put in place during COVID-19, unleashed a crushing wave of displacement, forcing families from their homes and onto the streets.
No kicks! No kicks!
At the same time, housing discrimination remains rampant, with Black and Hispanic Latino renters denied at far higher rates than others. This reality fuels their disproportionate presence in New York's homeless population. What's unfolding is more than an economic crisis. It is a systemic betrayal, stripping people of dignity and shattering hope for stability. The dream of a safe, steady home has become a distant illusion as the market grows tighter and the most vulnerable are pushed closer to survival's edge. At its core, this crisis reflects structural failure. Decades of policies have lagged behind the needs of a growing, diverse population. Governor Hochul's $25 billion housing initiative offers a glimmer of progress. Yet the slow rollout and widening gap between supply and demand reveal the depth of the challenge. Rental discrimination not only blocks access, but also magnifies racial inequities, leaving entire communities at greater risk. The end of the eviction moratorium marked a turning point, transforming temporary hardship into lasting displacement. This is not just about numbers or budgets, it is about human cost, broken trust, and the fading promise of home. As New York faces this housing nightmare, one question looms: what other forces are driving more of its people into the shadows of homelessness? New York's homelessness crisis is more than a housing shortage. It's a web of hardships tightly wound together. It's a mix of economic struggle, systemic gaps, and human vulnerability that traps the state's most fragile communities. Skyrocketing living costs clash with a lack of steady, well-paying jobs, leaving low-wage workers constantly on edge. For many, a missed paycheck or sudden job loss is enough to send them spiraling, stripping away the basics and pushing them into homelessness. The challenges run even deeper for single adults living with mental illness or addiction. Decades after state institutions closed, the promise of adequate mental health care remains unfulfilled. With too few psychiatric beds and strained services, thousands drift between sidewalks, shelters, and emergency rooms, locked in a cycle with no clear exit. Domestic violence adds yet another painful thread to this crisis. Women and children fleeing abuse often find themselves with nowhere safe to turn. Shelters are stretched thin, and while places like Lily House in the Bronx offer some hope for survivors, they can't keep pace with the overwhelming need. Together, these tangled struggles form a crisis that is as complex as it is heartbreaking. The influx of thousands of asylum seekers has pushed New York's strained resources to the breaking point. Policies limiting single adult migrants to just 30 days in shelters have left many with no choice but to return to the streets, worsening an already dire situation. Seniors, too, are facing unprecedented levels of homelessness, with dwindling family support and skyrocketing living costs, leaving many without stability. Young adults aging out of foster care, along with those newly released from facilities like Rikers Island, step into freedom only to discover they have nowhere to go. This tangled web of challenges exposes a safety net so frayed it no longer catches those most in need. Poverty, untreated mental illness, domestic violence, displacement, and systemic inequities all tighten homelessness's grip, pushing thousands further to the margins. Even when housing is available, many refuse, driven by distrust in a broken system, fears of unsafe shelters, or rules that clash with their realities. Each person's story adds a unique thread to this fragile tapestry, revealing that the crisis is not just about housing shortages, but about deep human struggles. New York's crisis cannot be solved with quick fixes. It demands a bold reweaving of the social fabric, one that ensures no one is left to fade into the city's shadows. One of the most striking parts of New York's homelessness crisis is why so many people choose the uncertainty of the streets over the shelter system. Across the city, thousands sleep in parks, subway stations, or alleyways, even after outreach workers offer them a bed. This decision challenges the common belief that anyone without a home automatically wants shelter, exposing deeper truths about the state of homelessness in America and the shortcomings of the systems built to address it. The reasons are sobering. Many shelters feel less like places of refuge and more like confinement, crowded spaces plagued by theft, violence, and unsanitary conditions that strip away any sense of safety. Strict rules, curfews, forced daytime exits, and invasive searches erode dignity and autonomy, leaving many feeling dehumanized. For those struggling with serious mental health conditions or addiction, groups that make up a large share of the unsheltered, the lack of specialized care inside shelters offers little reason to stay. Add to that the trauma of encampment sweeps, where personal belongings are routinely discarded and mistrust deepen. For many, the streets, harsh as they are, feel more honest than a broken system that robs them of both security and control. Yet this refusal is not a rejection of housing itself. It's a rejection of temporary fixes that fail to offer dignity or stability. When people are given permanent options, such as supportive housing or subsidized rentals through programs like the Housing Access Voucher Program, HAVP, the results are very different. Acceptance rates soar, because these solutions combine affordable homes with vital services like counseling, healthcare, and job support. A clear example is Lily House in the Bronx, which opened in spring 2025. There, survivors of domestic violence have embraced safe, tailored housing with relief and hope. The lesson is clear. People aren't turning down homes, they're turning down shelters that don't meet their needs. This refusal underscores a systemic failure to provide spaces that feel secure and humane. New York City's 2025 pledge to add thousands of safe haven beds, designed with fewer barriers and more support, is a step in the right direction, but the rollout is moving far too slowly. Outreach programs like Homestat aim to build trust by connecting with those on the streets, but their success depends entirely on what's offered afterward. To truly address the crisis, shelters must be reimagined, not as warehouses of desperation, but as genuine places of refuge. Only by respecting the dignity and individuality of those in need can the city turn the tide. The pressing question remains, how did the upheaval of COVID-19 make this fragile system unravel even further? The COVID-19 pandemic tore through New York City's homelessness crisis like a wildfire, laying bare long-standing weaknesses and sparking a disaster on a scale the city had never faced. Storefronts shuttered, jobs disappeared, and broken supply chains drove families into financial freefall. When eviction moratoriums, fragile lifelines during the pandemic's darkest days, expired in 2022, a wave of evictions forced thousands into the streets. The shelter system, already fragile, buckled under the surge, straining dangerously close to collapse. The pandemic's wounds cut deepest into the lives of the most vulnerable. Families with children endured the harshest blow as the number of homeless youth spiked, an alarming reminder of the crisis's human cost. Meanwhile, asylum seekers fleeing global upheaval arrived in record numbers, overwhelming shelters already beyond their limits. Social distancing measures, slashed bed space, pushing more people outdoors, understaffed facilities, plagued by worsening conditions, drove many to reject shelter altogether, choosing the harsh honesty of the streets over inadequate, unsafe refuge. COVID-19 didn't just worsen New York's homelessness crisis, it reshaped it, leaving scars the city still struggles to heal. COVID-19 shattered any illusion of stability, exposing deep cracks in the system. Black and Hispanic Latino communities bore the heaviest weight, suffering, disproportionate job losses, evictions, and housing insecurity. Programs designed to prevent homelessness were quickly overwhelmed, forced to turn away more people than they could help. These inequities weren't born of the pandemic, they were magnified by it, spotlighting a safety net that has long failed to protect the most vulnerable. What remains is a crisis that demands both hard realism and genuine compassion. The scars of COVID-19 are etched into the lives of those pushed to the margins, their struggles now woven into New York's broader homelessness epidemic. To move forward, the city must embrace bold, fair solutions that not only repair what has been broken, but also safeguard those still holding on. The choices made now will test New York's moral strength and define its character for generations to come. The scars of this era are far more than numbers. They are lived stories of resilience in the face of despair, of families torn apart yet struggling to rebuild. To turn away now is to abandon the city's most vulnerable, allowing inequity to deepen in silence. But to respond with courage and compassion is to shape a future where no one is left behind, where the hard lessons of this crisis lay the foundation for a fairer, stronger New York. The choice is urgent and unmistakable. It is not only about survival today, it is about preserving the very soul of the city for generations to come. New York's homelessness crisis is more than a policy shortfall. It is a test of collective conscience. Behind the statistics are countless lives, including thousands of students, each carrying stories of struggle, resilience, and too often abandonment by a system that fails to protect them. Recent initiatives, such as the state's 2025 rental assistance program and Mayor Eric Adams' multi-million-dollar campaign to address street homelessness, offer glimmers of hope. But they fall short of tackling the roots of the crisis, a severe shortage of affordable housing and a mental health system buckling under demand. Without addressing these deeper wounds, short-term solutions risk becoming bandages on a widening fracture. Short-term responses, like clearing encampments or forcing people into hospitals, often backfire, driving away those most in need. Many reject shelters not because they want to live on the streets, but because they fear unsafe conditions, rigid rules, and a loss of dignity. What's required is a bold shift toward lasting solutions. Supportive housing, such as the thousands of units promised under Governor Hochul's plan, offers real hope by pairing stable homes with counseling, job support, and health services. Reimagining shelters with privacy, safety, and even basics like Wi-Fi could help restore trust and bring more people in from the cold. Education must also be part of the fight. Too many homeless students fall behind or miss school altogether, trapped in cycles of poverty. School-based supports, like community coordinators, could anchor stability and opportunity for these children. Beyond policy, a cultural shift is vital. The stigma behind hostile architecture and punitive measures only deepens isolation. Homelessness in America calls for a vision where housing is a right, not a privilege, and where compassion, not expediency, guides choices. The question remains, can New York rise to this challenge and secure a future where everyone has a place to call home? New York's homelessness crisis is the product of a perfect storm. Soaring housing costs, economic instability, untreated mental health struggles, domestic violence, and the lingering scars of COVID-19. Together, these forces have created a humanitarian emergency that touches families, students, and individuals across the state. In New York City, shelters are beyond capacity, while racial inequities remain glaring, with Black households bearing the brunt of the hardship. The pandemic's fallout only magnified these struggles, tearing through an already fragile safety net and exposing the deep structural cracks that left so many vulnerable. This is not just a housing problem. It is a test of justice, resilience, and the state's commitment to ensuring a future where every New Yorker has a place to call home. New policies are sparking cautious hope. Programs like the Housing Access Voucher Program, the expansion of supportive housing, and Mayor Eric Adams' multi-million-dollar push to tackle street homelessness all signal progress. Yet the reality is stark. These measures still fall short. With many people leaving shelters due to unsafe conditions, lack of trust, and frequent raids, quick fixes cannot solve a crisis this deep. What New York needs is a long-term, transformative approach. That means building more affordable homes, reshaping shelters into true places of refuge, and investing heavily in education and mental health care to strike at the root causes of homelessness in America. But this mission cannot rest solely on government. It is a call to communities, businesses, and everyday New Yorkers to stand together and ensure no one is left without a place to call home. The path ahead will be tough, but it is unmistakable. With bold action and shared compassion, New York has the chance to lead the nation, proving that even its hardest challenges can be met with unity and resolve. The question remains, what will it take to turn this vision into reality for every New Yorker?